Perfect. So for today's, our first speaker for today is Dr. Janayra Rivera. Dr. Rivera is an assistant professor in the Department of Communication at Rutgers University's School of Communication and Information. Originally from Puerto Rico, Dr. Rivera's scholarship focuses on reducing health inequities and improving the well-being of Latinx and underserved communities through health communication initiatives. Her work uses qualitatively driven, mixed methods, and community-based participatory research to study social media health misinformation, cancer control and prevention, and disaster relief. She specifically studies how engagement with health misinformation on social media can impact health decisions and how to use social media as a tool to communicate with and mobilize communities. Dr. Rivera is an associate member of the Cancer Institute of New Jersey's Cancer Prevention and Control Program and a member of the Rutgers Global Health Institute. Prior to her doctoral work, Dr. Rivera was a community health educator through the U.S. National Cancer Institute Center for Reducing Cancer Health Disparities. Dr. Rivera has a PhD in social and behavioral sciences from Johns Hopkins School of Public Health and an MPH in behavioral sciences and health education from Emory University. Thank you so much for joining us here. Dr. Rivera, feel free to move forward.
Thank you so much, Rosie. It's such a pleasure to be here today and share some knowledge with everyone who is in the audience. Before I get started, I just want to briefly go over an outline of what I'll be talking about for the next 30-40 minutes. I want to start by talking a little bit about principles of health communication that we can use to develop successful health campaigns. And that is a huge topic, of course, but I'm going to hone in on talking a little bit about audience analysis and segmentation and why that's really important when we develop campaigns for different entities and different groups in the community. Then I'm going to briefly talk about the different types of communication factors that are important to consider when we design campaigns, but then I'll hone in on message sources and communication channels and how we can do a better job of selecting the right type of source and channel for our audience. From there, I'm going to talk a little bit about social media and pivot into the very relevant topic of addressing health-related misinformation on social media. I'll give a little bit of context and some examples from the work that I've done with the Latinx community and cancer information and misinformation on Facebook. And then we'll go into some recommendations on what we can do to combat misinformation and kind of understand this media landscape so that our health campaigns are a lot more effective. And then we'll wrap up with just some resources for how your organization can design culturally tailored and non-stigmatizing health messages that you can integrate into your programmatic work. So let's get started with all of that. We're going to start with principles for health communication and using these to develop successful health campaigns. So I always like to start talking about health campaigns by describing some of the characteristics for an effective campaign, right? And many of you have probably already developed campaigns for your specific groups and focus populations. And you might know some of these, but the first thing that we want to make sure that we're doing is that we are clearly defining the goals of a campaign, right? Because everything that comes from those goals is how we are going to be able to measure the effectiveness and evaluate whether or not what we were intending to do really gets to our audience and they're able to integrate it. So if that's raising awareness, that's very different from behavior change, right? It's important to have those goals defined. Another very important facet in the design process is clearly defining your intended audience. And we're going to spend a lot of time talking about that at the beginning of today's webinar. In having a clearly defined audience, we can ensure that messages are effectively tailored to the recipients, right? We also want to make sure that we pre-test and revise any materials when we are developing them to ensure that they resonate with the populations that we're trying to reach. And then, of course, an effective campaign is going to have measures tied to it to demonstrate that it was implemented adequately and that we can show success through these evaluations. Now, when we dig in a little bit deeper in the campaign design process, as I mentioned earlier, the first step is really to identify your audience and formulate those communication objectives. So this becomes very important because when we identify the focal segment of the audience that we are working to educate, as well as the specific behaviors that we want them to embark on or address, then we can have a much more effective message design. Now, once we identify at a global level these different audiences and the goals that we have, we then want to go a little bit deeper and we want to conduct audience and behavioral analyses. So there we're going from understanding that perhaps we want to reach Latinx communities. But really, when we go into our audience analysis and behavioral analysis, we can pinpoint an age group, perhaps a type of gender, a sub-ethnic group. Maybe you don't want to just focus on Latinos and you want to focus on Mexican Americans in Elizabeth County, right? So the more honed in you get and the more you understand why that particular group is perhaps not embarking on the behavior that you want them to embark on because of stigma, perhaps because of fears of different social or cultural norms, misinformation, right? Then you can start tapping into actually devising a communication strategy that is going to meet those needs. So again, when thinking about design, I can't stress how important within communication it is to have a very specific audience and segment. Audience-centered strategies are the cornerstone of effective health communication campaigns. And when we couple those with theory-driven decisions and evidence-based decisions, then we can ensure that we are engaging audiences in a way that we can demonstrate that effectiveness and continue to get funding for the groups that we want to serve. So those are just some of the background things that I wanted to go over. And here, I'm not going to go over these questions in the webinar, but I do want them to be here as a resource for when your organization does start thinking about how to identify the adequate target group or population of focus. So you want to ask yourself questions like, what's reasonable and realistic for this intended audience? What are we trying to achieve through our objectives? What are the members of this audience segment going to benefit from in receiving this communication? What resources and channels do we have available and can we use to reach this segment? And how are we going to be able to assess progress, right? So we're going to talk about all of those things in the next few slides. And I want to start with some foundations regarding really conducting an effective audience analysis. So when we talk about audience analysis in the health communication world, this really involves getting to know your audience beyond just demographic factors, right? You also want to think about behaviors, cognitions, motivations, media use, etc. And really having an in-depth understanding of your audience is going to allow you to better segment and tailor the objectives, channels, and messages to specific groups within that potentially broader audience. And in doing so, this is going to allow you to really identify messaging strategies that are going to be more effective depending on the segment of the audience that you want to tailor. Now, when we do this, the first thing we want to be asking ourselves is, what are the purposes and objectives of the messaging that we want to deliver to this group, right? Why are you communicating to this particular audience? And whose behavior are you trying to change in particular, right? Is it the parents? Is it the children? Is it the school board, right? You want to make sure that you have a very clear understanding of who you want to be reaching before you embark in spending resources to select different communication channels and source messengers. You also want to think about how many resources you have available to conduct an audience analysis. So you can conduct audience analyses at a baseline level where we kind of think more of things like demographics, perhaps health outcomes, right? Like, are there any specific groups that have more health inequities based on data that we can find for that particular health outcome? But then as you go into midline and comprehensive types of analyses, you start thinking a little bit more about how people are actually receiving information and their attitudes, and we start tapping into more of these behavioral change theories, right, that we all know, to understand where we can intervene. I have a resource linked at the bottom that I will make available to anyone who wants to see more in depth how to do this kind of segmentation. But here are just some examples of ways that you can segment your audience and analyze your audience so that you can make decisions later. So you want to understand behaviors, previous, current, how they've done things in the past, what has worked and hasn't worked. You want to understand cognitions and motivations, because a lot of times our health campaigns are really targeting not the level of behavior change, but raising awareness, changing attitudes, right? Like more of these cognitive things that in the longer term are going to lead to behavior change. You also want to understand the literacy and comprehension ability of your group, right? Are these individuals who have a higher reading level or a lower reading level, higher educational level, lower educational level? Can they understand instructions that are going to be disseminated in your messaging? Similarly, and importantly to the topic of today, we want to be thinking about communication and behavior preferences, right? We want to know where people like to receive their information and where they are receiving information generally, that we can reinforce our messaging by having our campaign delivered there. And then of course your demographic and psychographics. And when I say psychographics, that's more like lifestyle and other things that relate to an individual's identity that go beyond their demographic variables to make decisions about their health. These are just for later for you to be able to see all of those different examples that I gave here. But I want to move into some suggestions for selecting the right audience. There's no one way to do this. As you know, as community partners, you have probably had to make these types of decisions, but at the end of the day, you want to make sure that you are using the information you get from your audience analysis to make decisions about where you want to allocate resources and funds for a very well-developed campaign. The best thing and the best way to do this is to have focus groups, interviews, talk to community leaders, stakeholders, etc. But sometimes we can't do that. So in this slide, I have a list of different types of sources that are useful when you might not be able to directly talk to your audience. Now, the difference between audience analysis and audience segmentation is that it's the same kind of information that you're using. In your audience analysis, you have a landscape, and then you use that information to segment your audience and have slightly homogeneous subgroups of your population of focus so that you can tailor your messages to each of those subgroups within the broader area of your campaign. This can help us increase efficiency, effectiveness, or focus, depending on what the goals of your initiatives are. And when we think about ways to segment, as I mentioned, you can use the same information from your audience analysis to do so. And these are just some examples of ways that you can segment your population. So I want to continue by talking about important communication factors that we include in campaigns, and then hone in on source and channel to talk about them more specifically. So we like to think about communication factors as 5 different layers within your campaign. The first level of factors, of course, are those that relate to the message. So the content, the structure, the style. We're not going to go over those today. The second and third are very interrelated. First one being source factors. So those are attributes that you can give the perceived source of the message. And channel factors are actually the communication channels and platforms that you are going to use to deliver the message. Of course, this is communication, so you always want to use characteristics of your audience to make sure that the message is being received to the right group of people. And when we think about destination or contextual factors, this is just really understanding the broader goals of the campaign within which you're going to be designing your message. So let's talk a little bit about message and source factors. I'm sorry, about source and communication factors. So the first one that I want to talk about is the source. So the source of a message can be a person, it can be a group, or it can be an institution. It might be a combination of all of these things. For example, Proceed, the organization, might have certain information that they want disseminated, and they might be the ones who are disseminating it, but they might also use a spokesperson who then becomes another part of this source of the message that is getting out to a particular audience. Now, a thing that I want to highlight is that source characteristics are more influential when treated as cues, right? Which we'll go over in a second. But they can also be influential when a person is actually paying a lot of attention to a message and really processing that information deeply. And generally, there are 2 categories related to the source that are really important to consider. The first one is perceptions of credibility, and the second one is liking. So as you can see here, I have 2 very different examples of potential sources for an educational message. The first one being Selena Gomez, the second one being Dr. Anthony Fauci. Depending on the audience, the same type of message might be received as more or less credible given who the person is that's disseminating and the context of the message. With Dr. Anthony Fauci, a lot of individuals saw him as the face of the COVID-19 pandemic and as, at least at the beginning of the pandemic, a neutral, credible source of information because he was coming from the National Institutes of Health. However, credibility is receiver-based, so there may have been other individuals who, despite the accuracy of whatever information was being disseminated, did not perceive Dr. Fauci as a credible source of information regarding the pandemic. If we switch gears, well, or in this vein, perhaps the same people who deem Dr. Fauci credible, if they received the same kind of information from Selena Gomez, they wouldn't deem her a credible source. And maybe they would rely on the fact that she was citing information from the Centers for Disease Control and Prevention. However, a younger audience to whom you're talking to about mental health issues might deem Selena Gomez a credible source of that information because she has been very open and vocal with conversations about her own mental health struggles. And a lot of youth may see her as being credible. It's situational and contextual to mental health and is always going to be changing, right? So with that in mind, there are 3 dimensions that I want you to always consider regarding perceived credibility of sources. The first one is that a source, again, regardless of the accuracy of the information, a source may be perceived as competent or having expertise. And here you can think of, okay, does this person know their stuff? So you want to understand who your audience deems competent in the particular area that you want to be educating about. Similarly, with trustworthiness, if a source is perceived as having integrity, honest, having character, can I trust them? Are they lying to me, right? That reputation is also going to have a lot of weight in whether or not audiences perceive a source as being credible. And a third facet of credibility is perceived goodwill. Do they perceive, does your audience perceive the intentions as good? Does this spokesperson, does this individual or organization care about my well-being, right? So all of these facets are very important. We've seen in the literature that perceived competence is very important in credibility assessments, but they all play a role. I'm going to actually skip through here and go straight to liking, which is the other facet that we think about when we think about sources. So liking is actually a function of a lot of things that we don't associate with perhaps accuracy or credibility in a message. Liking can be related to physical attractiveness, whether or not I see myself in the source, in the person who's conveying the message, whether or not I presume that the source's intentions are good. Are they similar to me? Do they look like me? Do I aspire to be like them? Right? All of these things are really important. And this is important to take into account because as we, as organizations, start to move into social media spheres to also have our educational campaigns be reaching our audiences, social media is a space where people are distracted and competing for attention on a lot of things. And they're not necessarily on social media to learn about health topics. So you want to be able to get people to grab their attention and then pay attention to your message and consume it. And sources, credibility, and liking can help in those things. Now, another thing that I want to briefly talk about is communication channels. We tend to group communication channels as interpersonal, mass media, and community. I'm not going to go over these in depth because you are all very familiar with these different types of channels, especially using community leaders and partners in efforts to reach specific audiences. But the main thing that I want you to consider is that there's always going to be some trade-offs. So the more specific you get with your audience, the more tailored and rich and perhaps interpersonal you might want to get with some of your messaging. Think about things like cost, reach, frequency, impact, and personalization when you make these decisions. But another thing that I want to make sure that everyone is thinking about is the different criteria that communication channels afford your audience. So you want to think about things like connectivity. Are you trying to get people to connect and share information on a particular platform, right? Then maybe using something like Facebook might be useful. Same thing with interactivity. Do you actually want people to engage with your campaign or your communication efforts and respond, right? That's something that you might want to take into account with different platforms or channels that you choose to use. How accessible are these platforms to your audience? Is there the ability of feedback and dialogue? Can you integrate different channels? Maybe you use YouTube and Facebook, but you also have a PSA on local television, right? So you want to think about all of the different things that channels afford. Now, I want to do a very quick poll and get a sense about your social media utilization. So if you can, I know that the poll might be able to be active. There we go. So I want you to, in the first one, select all of the platforms that you use, all of the social media platforms that you're a part of. And in the second question, just select the one platform you use the most. Do we have enough of a response, Rosie, to get this
Not just yet. In a few
Not
seconds,
yet?
we have
Okay.
a few folks who are about 50%. So I'll go ahead and end the poll now, and then everyone should be able to see the results.
Okay, so here with the first one, we see that within our group, we have a lot of Facebook and Instagram users, we have a few WhatsApp users, and then it kind of starts trickling down from there. However, in the second one, we see that Instagram is the more popular platform within the people in the audience, followed by Facebook, right? I do this because it's important to highlight that when we think about social media as part of our campaigning efforts, we tend to try, or you can see that sometimes organizations just say, oh, so where is the most amount of people, right? Or Facebook, great, let me have a Facebook campaign. But you really want to understand not just where people are, but how frequently people use things and how they use them. So I've linked here Pew Research Center to just give you resources where you can look at statistics regarding different social media utilization patterns by age range and other demographic factors. As you can see here, a great example is within the Hispanic or Latina, Latinx population, or in the general US population, WhatsApp is used 23%, but when you break it down by sub-ethnic group, you can see that Hispanics actually use it 46%. That's an example of a platform that if you don't really understand how your specific audience is using, you might miss. So you want to make sure that you know where people are and how they're engaging with content so that you can have more reach and accessibility to your audience. With that in mind, I'm going to skip over this slide in the effort of time, because I really want to make sure that we can discuss a little bit about health information and misinformation on social media. And this is important because, as we saw on the previous slides with the data, a lot of people are on social media and multiple social media platforms to get information about a myriad of things. And when COVID-19 happened, we saw that a lot of individuals were trying to find information in a moment where social distancing was in place and we had a lot of information overload, right? We had a lot of information and we didn't really know what was real and what wasn't. A lot of information uncertainty, which is what led the World Health Organization to coin the term infodemic. I'm sure that some of you have already heard of this term, but basically what they were positing with this term is that there was an overabundance of information, including misinformation, that people were trying to navigate. And this became exacerbated because we do have a very different media landscape now, where in part due to the presence of social media and people actually going to social media even more during the beginning of the pandemic because they wanted a level of connection, you had people like perhaps sifting through information in places and in formats that they didn't recognize before. So this becomes very important for us to take into account when we are designing PSAs and understanding that media landscape, because now we also are going to not just be competing with misinformation about a topic that's coming from perhaps a non-reputable source, but an organization or a politician. Anyone can create content now, which makes the landscape on social media even more busy, and it makes it even more important for us to share evidence-based content in ways that the people that we want receiving it are receiving it and engaging with it and understanding it to make better health decisions. So I want to talk a little briefly about this within the context of my work. So I do a lot of research with the Latino, Latina, and Latinx community, exploring how we can use social media to have a better understanding of health inequities and address some of the disparities that exist. And a lot of my work focuses on cancer. In this particular study, we looked at how Latinos who don't have cancer, but we wanted to target screening and prevention type of cancer messages, what they were actually engaging with on Facebook, which at the time was the most popular platform that Latinos were using. And within the context and kind of tying some of the information together that I've shared on previous slides, social media in the context of COVID was a very important source of health information for a lot of Latino audiences. And if we know that, and we also know where these Latino audiences are using, like what platforms they prefer, then we can have a better understanding of how to reach them to combat the misinformation they might be reaching. When we think about how people assess information credibility on social media platforms, the easiest way to describe it is that as humans, if we are motivated and have the ability to evaluate the information that we're receiving, then we are going to probably want to have a lot of detail and search to make sure that we can assess, okay, this is from a reputable source. Let me go to the website. Let me check the link. Let me see all of the information and compare it to what I know. But on social media, as I was mentioning, that doesn't happen as often because a lot of times we might be scrolling through something when we're at the supermarket waiting to pay, right? So when that happens, we might use what we call the peripheral system, or we might just go off of rule of thumbs to make assessments about whether we think something is credible. That might be something like, oh, my friend shared it and I trust them. Oh, this sounds like something that I've heard before, so I'm going to trust it. Oh, this has a lot of likes, therefore it must be true, right? So understanding that can help us make better informed decisions. In the research that I saw with the Latino community, as an example, we saw that culture influences a lot of the interpretations that people are making when they are going through those rules of thumb to navigate information on social media. And this can be good, but it can also be detrimental. We've seen with COVID that there have been negative implications and outcomes to people who consume misinformation, but this isn't only exclusive to COVID. The best example I can give from my research is a participant who saw a video. She was Puerto Rican and she saw a video from someone in Spanish who was Puerto Rican and claimed to be a physician, saying that mammograms cause breast cancer. And this caused enough of doubt in her, coupled with all of those heuristics that she used to make sense of whether this was credible, she actually canceled her mammogram, right? So this is what we are fighting against when we are on these platforms. And in the next few slides, I'm going to highlight some ways that we can hopefully combat this. One of the ways, going back to the beginning of my slides, is understanding the importance of sources. So in the work that I was doing, I saw that at times, who shared the information was just as important, if not more important, than the actual information itself. And if we understand who our audience members perceive as trustworthy, as an expert, and at times even align with elements of their identity, right? That whole liking feature that I mentioned earlier, then we can use that to our advantage. And that's what we saw in some of the work when talking to participants. There's a community activist that was very well known within the Latino community in Tampa, and he was always sharing information about a cancer center and screening events and educational events that people automatically, without having to vet, would trust him, therefore would attend these events and engage with this content. So with that, I want to pivot in the last few minutes to talk about some recommendations that you can incorporate when designing culturally tailored information and content to combat misinformation. So the first thing that I want to mention is the importance of partnering with local organizations and community leaders. I am preaching to the choir here, so I'm not going to go into depth there, but what I do want to highlight is that community leaders are trustworthy sources that can be leveraged in communication efforts. The second thing that's important to consider is the idea of counteracting misinformation by disseminating culturally tailored narratives or other information that is easy to digest. We have seen with narratives that in different audiences, or let me take a step back, misinformation thrives in part because it tends to be a sensationalist or emotionally evocative story or experience, right? It's not necessarily statistics that are generalizable. We have seen in health communication that we can also tap into the power of narratives, and particularly culturally tailored narratives, to address these things as well. So that is definitely an area where you can focus your efforts to counteract misinformation on social media. And then lastly, using these community leaders and trustworthy sources, trustworthy figures as sources of your information. I'm going to skip over these slides, but again, for those of you who want to develop messages and want to make sure that you're mitigating any misinformation that's happening or that is competing with your message, you can address information overload, uncertainty, and misinformation in this way. And I want to finish talking about this particular effort in combating misinformation by pointing you to a resource that myself and other colleagues at the Johns Hopkins Bloomberg School of Public Health Center for Health Security wrote and presented to the US Senate back in 2021. It's a national priority to combat misinformation and disinformation about COVID-19 and other public health threats. And it is very user-friendly. It's written in a way that any organization can really use and digest this information. And we present 4 different pillars that are important to consider when targeting misinformation, not just online, but mainly online. The first thing that we want to do is that we want to make sure that we are correcting and minimizing the amount of misinformation that's out there, of course. And where, as community leaders, organizations, and health communication scholars, in the second pillar, we want to be promoting, right? Like putting out a lot of accurate information to combat the misinformation in ways that are appealing to your audience. The third pillar that's also very important is thinking about initiatives where we can increase the resilience of audience members, of our focused population, to understanding how to navigate information on social media. So how can we actually educate our constituents about the ways to identify when something might not be credible on different platforms, giving them skills and resources for that. And then lastly, this is where collaborations like the one that we have today and reaching out to other groups, we need to have multi-sectoral, interdisciplinary work to ensure that there's a national response more at the policy level. So I have a few minutes left, and what I want to do in these last few minutes is just share a few resources for designing culturally tailored and non-stigmatizing health messages to different constituencies. And the first thing that I want to highlight is, of course, some of the lessons learned that I've had with working with community partners and organizations like yours. So you always want to make sure that you're listening to community leaders and working around their needs for success. That's a core principle in community-based participatory work, and really contributing to conversations regarding sorry, I saw a chat and I got a little distracted. You want to make sure that you are really working with your community and understanding the needs that they have, so that trust is being built long term. And that is something that at times we forget. We go in with the best of intentions into a community, yet we aren't listening to what they actually need, even though it might not be what we perceive they need. So that communication is very important. Another thing that's very important is to ensure that you are working around resources that are available within the community. And if your organization is actually a very present or entity in that community, that's fantastic. But sometimes we go into communities to deliver a service and then we leave. It's important that there's always sustainability and that there's always listening to what resources are available, so that when we remove ourselves, there's still efforts that can be continued on the ground. You also want to tap into trustworthy, engaged, and active community partners, especially at times when we're working from afar, we're not a member of that particular group. And then lastly, communication with the community needs to be consistent. You can't just pop up. But again, preaching to the choir, we all know this. Now, I do want to point you to another excellent resource. It is another compendium that was created by the Center for Health Security at Johns Hopkins, called Equity in Vaccination, a plan to work with communities of color towards COVID-19 recovery and beyond. It is a wonderful resource that could be an entire workshop in and of itself, with ways to implement this kind of work. So I will point you to that resource. I also wanted to give an example of what an adequate culturally tailored narrative can look like. This is a video that was created in a nutshell, in Los Angeles County, cervical cancer screening rates were very low. This particular research team developed a culturally tailored narrative style video that was delivered in different communities of color, including Latino communities. The rates among Mexican American Latinas after watching this video went from 38% of Pap screen uptake to 81%. So these types of programs work. Again, this video is linked as a resource, so anyone who wants to watch it and reach out to me for any information, that would be fine. And then lastly, I also wanted to highlight the importance of health literacy and using resources like the CDC's health literacy page to really understand how to tailor messaging to your audience needs. So I am going to finish with that. There's so much more that I could talk about, but I am really excited to have the next speaker answer any questions you have in the Q&A. And if anyone has any further questions or would like any of the readings or resources, please do feel free to reach out to me or contact Proceed, and I am happy to do so. So thank you so much.
Thank you so much, Dr. Rivera. We did have one question that was entered into the Q&A box. And the question is, what is the most effective strategy to measure the reach and changes generated in the audience connected to the focus population or the target when using social media?
Okay, that is a really good question. When we think about engagement, and I did skip a little bit through the engagement portion, but one way that you can have those types of evaluative metrics, if your organization has, say, a Facebook page, you can use those metrics to see how many people saw, how many people, like what your reach was. I will say that that is not the only way, right? That does show us how much a message is actually spread. But if you account for how you are going to be disseminating your messages ahead of time and build in surveys that you can maybe use an ad feature or post on the particular page to see whether or not at a longer term any of the messaging was effective outside of the Facebook platform, right? Then that is definitely going to be resourceful. I'm happy to talk to anyone who has more questions about how to do that.
Perfect. Thank you so much. And we'll go ahead and wait to see if any additional questions are entered into the Q&A panel throughout the rest of the session. But for now, I'll go ahead and I'll begin sharing our next speaker's slides. So just bear with me as I shift over. Perfect. And so our next speaker here is Rashad Bell. And so Rashad is a lifetime Southside resident of Chicago. Rashad started his career in civic engagement as a development manager at Impact Family Health Center from 2009 to 2020. Rashad is a member of the Obama Foundation Community Leadership Corps 2018 cohort and is heavily involved in health equity and community engagement and outreach in Chicago for the Black, Brown, and LGBTQ plus communities. He has a wealth of experience in community engagement, partnership, and capacity building. Rashad is now the manager of community engagement and strategic partnerships at Howard Brown Health and helps to create brand visibility, implement community health events, connect with legislators, community organizations, and city council members to promote health services and combat health disparities in marginalized communities. So thank you so much, Rashad, for being here with us today. I hope that the community-based organizations who have joined us can see exactly how the principles that Dr. Rivera has explained and described in detail have truly applied to the work that you are doing with Howard Brown Health. It's phenomenal, everything that you are doing. So we're so happy that you have been able to join us here today, and I'll pass it over to you.
Well, thank you so much, Rosie, for that introduction. And thank you, Dr. Rivera, for that wonderful presentation. It's a pleasure to share space with you all today. My name is Rashad Bell. My pronouns are he and him. And as Rosie said, I am a born and raised Chicago citizen and a proud Southsider and community activist. And it's my pleasure to be here with you all. And I'd like to thank Proceed Inc. and their technical assistance team for the invite to share space. So yeah, without further ado, we can go to the next slide. Thank you. So before we get into kind of like the meat and potatoes of what we're going to be talking about today, I wanted to provide everyone with a brief overview of who Howard Brown is and what we do. So Howard Brown is a federally qualified health center located in Chicago and is the only federally qualified health center in Illinois focused on the health and needs of the LGBTQ population. Howard Brown has grown and blossomed to a full healthcare operations organization with over 11 clinics across the Chicago area. And we are the largest healthcare system for LGBTQ people within the Midwest. And even though we are an LGBTQ organization, we do service everyone regardless of how they identify. Next slide, please. All right, so just again, a little bit about our mission. We're really rooted in LGBTQ liberation, and our primary source is affirming primary health care. So that is what our primary mission is for Howard Brown Health, and we really want to make sure that we are focused on that, and that is built in everything that we do. We provide social services as well to all of our clients. We have diabetes case management, queer family building, which helps queer families to be able to start families. And with that program, we also have an artificial insemination program and a doula program where we work with folks who have become pregnant and would like to go through the birthing process in an affirming way. We also have a TGNC, which is Transgender Nonconforming Surgical Navigation Team, that really helps to get affirming services for our TGNC population. And then we also have a harm reduction team as well that focuses on harm reduction and safe drug practices with things like hepatitis C. And we have a needle exchange program, as well as some other harm reduction tactics that we use to help combat some of the different issues that we're having with drug use within our city and within the state right now. And we also have a sexual harm team, as well as a HIV case management team, as well as a youth services branch of our organization, which is our Broadway Youth Center, which is a full clinic with wraparound services all in one building to be able to help our high-risk housing insecure youth within the city of Chicago. You go to the next slide. All right, so we have a few learning objectives for what this discussion will be about today. We're going to be highlighting what trauma-informed and harm reduction approaches look like to health messaging. We also want to be able to understand the uniqueness of each community that we serve, because we do know that not every community looks the same. So being able to identify what the uniqueness of each community is. We're going to identify potential approaches on how to address public messaging for those communities, considering the fact of their uniqueness. And we're also going to learn how to apply the emphasis on diversity, equity, and inclusion in your messaging to make sure that you are broadening your scope when you're talking about some of the health messaging. Next slide, please. So why is health information messaging important? And for Howard Brown, we have prioritized our health messaging because we understand that our health messaging is one of the leading organizations within the industry or within our city and within the Midwest area, where we are seen as a credible source to the community. So we're very careful about what we put out, and knowing what that small organizations will be taking our lead. We want to make sure that we're giving out the correct information and we're distributing information in a very correct way so that we're not contributing to the infodemic that Dr. Rivera so graciously pointed out. And we also have prioritized our health messaging to reflect our mission and vision and beliefs as an organization. One of the things that we really want to ensure that we are not contributing to the harm of what's already happening within certain marginalized communities. We also want to reduce and combat the stigma that is happening within those communities, especially in regards to health messaging and some of the health concerns that we have went through within the past years, specifically COVID-19 and MPOX, formerly known as monkeypox. And then we also want to help our patients feel heard, ease their fears, and encourage to disclose relevant information, and also give them the tools that they need to make informed decisions. One of the things that we realized during COVID is that communities just did not have access to the right information or avenues to get the correct and up-to-date information. And so we wanted to make sure that we positioned ourselves at the forefront of being able to provide that information as a credible source, not only within our city, but within our community as well, particularly in the LGBTQ community. We also understanding that combating health information and providing forums to address community concerns and give them correct and accurate information was the key to really combating a lot of the hesitancies that we were facing when we were going through the COVID-19 pandemic, as well as the MPOX onset as well. Go to the next slide, please. So one of the most important things that we do, especially in regards to outreach, is we really want to identify the communities that we're serving. So looking at what the demographics of that community is, what the cultural competencies are of that community, and really ensuring that we're working with the community on the ground. So working with businesses, schools, religious groups, daycares, community organizations, as well as local newsletters, blogs, and other avenues where folks will receive information, making sure that we're working with those people within our communities to really identify what community we're actually going into and how we can best present that information to them. And one of the ways that we identify with communities is staffing at the event. We believe that relatability is key to building a positive rapport, and it is one of our biggest tools in our kit, and that's diversity in our staffing. We really want to make sure that the community that we're serving is being represented in the staffing of our organization, and especially of our outreach team. That's been very key. And we have really tried to make sure that we're being very cognizant of that when we're hiring people for our outreach team, making sure that we have the most diverse team as possible, because we do have 11 locations across Chicago, and we have very different demographics from all of the neighborhoods that all of our clinics serve. And so we definitely wanted to make sure that diversity was something that was key when we were building out our outreach teams, to making sure that we could properly identify with community. Another thing that we also wanted to make sure of is that we were looking at what the social determinants of health were within that community. It was important to know that, because that would help us figure out what messaging we needed to push out and what communities we needed to be reaching out to. And I can give an example of that a little later in the next slide, or the next few slides or so. But just making sure that we're addressing what the social determinants of health are within those communities, and ensuring that the messaging that we're pushing out to that community is reflective of that. And we work with local health departments to also make sure that with looking at the messaging, we're giving the right message to our constituents and to our communities by working with the health departments, because they are already doing some of that work on the ground locally. And then another example I can think about is we've worked with the Chicago Department of Health to really talk about some of the communities that they weren't mentioning when they were talking about the mpox outbreak, and how many high-risk demographic populations were going to be affected by that. We had to have a conversation with our city health department to talk a little bit about, what were some of the qualifications that, they were looking at when they decided on who would be able to receive the mpox vaccine. And then we took that information and really looked at, all of the demographics that it actually affected. And we actually seen that the population that was missing was the trans women community, because with the health messaging that the city was using, they were really focused on the MSM population, and men who have sex with men don't necessarily include the trans women community. But we also understood that the trans community was very vulnerable to the mpox outbreak, and we wanted to make sure that we were being inclusive of that community. So really working with the local health departments to make sure that, they're even pushing out the right messaging, and that we're working with them to make sure that we're giving the most accurate messaging as possible. And then also working with, churches to get the faith-based community buy-in, and using those relationships as an avenue to set up discussions and town halls, webinars, as well as other community outreach, community health outreach events, such as testing events or vaccination events, and really working with those community organizations on the ground to uplift the work that they're already currently doing, and then using those avenues to also collect data for us as well, to take that back to our teams to figure out how we can continue to impact the communities that we're trying to serve. Next slide, please. And so one of the things that we really wanted to do was create relatable messaging. So, when you're creating messaging for these particular communities, you really want to make sure that you're identifying with that community in a very real and relatable way. So, we want to use images of people from different races and cultures and ethnicities that are from that community. And I'm also very cognizant about making sure that we're representing the community within everything that we do. So not only our community engagement, but our health messaging, and even the photos and information that we use in that messaging, to be very intentional about making sure that we're reaching out to the right community. And then using social media platforms to engage and push your initiatives. How around social media is a huge, huge way we get a lot of our health messaging out, because a lot of the communities that we serve do utilize social media as a primary source of where they receive their information. So us knowing that and looking at our demographics and our analytics within our Facebook pages, Instagram pages, as well as the other social media pages that we have, we really wanted to make sure that we're putting out the right messaging to the people who are actually engaging in those social media platforms. And then we also wanted to make sure that we're not using a lot of words and a lot of messaging, especially on social media, because as Dr. Rivera mentioned, a lot of people, don't necessarily go on social media to look for health information, but we do know that social media is a great way to get good information out. So making sure that our information is extremely concise, very authentic and relatable in less than 200 characters. That's our kind of like go-to maximum of how many characters we want to use within a particular statement. Because we understand that once folks, see a large paragraph, they're probably going to keep scrolling. But if there is, graphics and there is, a short, small sentence or something that they can read very quickly, it can get that message across, faster and more efficiently. And so we definitely wanted to make sure that when we are creating health messaging, that it's relatable, it's authentic, and we're keeping it as short as possible so that we can keep the reader's attention. Next slide, please. Okay. And using social media and advertising, again, like I said, is one of the largest platforms that Howard Brown uses to get our health messaging out. We use social media in the pandemic for COVID-19 to really start to combat some of the misinformation that we were receiving in a lot of with a lot of our patients and a lot of the clients that we were working with in community. And even our community organizations came to us because they also trusted us with help with providing that health information to those communities. So bringing in experts to talk about those subject matters, really making sure that you have credible sources that people can actually listen to and take heed to what they're saying. Using local newspapers and magazines to really tailor to a particular audience. What we realized in COVID-19 is that we were dealing with 3 different audiences. We had, an audience who was, very hesitant about taking the vaccination. Then we had an audience who was also, very open to it. And then we also had a community that was really on the fence. And then we also had to look at those three kind of like subject groups, and then also break those down a little bit more to look at the demographics of those groups. So when we looked at how folks who were hesitant to the vaccination, what demographic within that population do we need to really focus on? We started to look at the analytics and data and understand that a lot of the people who were hesitant and combative, who were taking our hesitancy surveys, were between the ages of 18 and 29 years old. So we started to put messaging out to that particular group and tailored it to social media platforms that they use the most. And I'll talk a little bit more about that in a little bit. And then we also understood that we had a very older population as well, who may have been on the fence. And a lot of people that we've seen within our surveys who were on the fence about vaccination hesitancy were really in between the ages of 40 and 55 years old. And the folks who really wanted to take the vaccine were the 55 and older age group. And of course, that's because of how the information was also being rolled out from the CDC and, all of the other entities that were giving out information. And so we wanted to start to get ahead of some of those hesitancy issues. So we wanted to make sure that we were using our social media and advertising platforms to address concerns within each particular niche community, because every community had different demographics, and we had to give a tailored approach to how we address those misinformation and hesitancy with the vaccines. And then we also realized that we have a very unique position as Howard Brown Health to really get great messaging out to our LGBTQ population. And we really used a lot of LGBTQ dating sites during the MPOX outbreak, because we understood that the population that was being affected by MPOX was the LGBTQ population. So we came together and said, how can we get the right messaging out to our community as the LGBTQ community, and make sure that we're covering all of our avenues. So we used our dating apps like Jack'd and Grindr and Growler and some of the other LGBTQ dating apps to really push a lot of messaging about MPOX. We also had some of our health educators and outreach team members start profiles to just have conversations with people and just start that dialogue about, like, how are people feeling about MPOX, and, what are your hesitancies about the vaccination, and do you have any questions? And then we would collect all of that data and really use that to kind of push us in the direction that we needed to go in regards to what our messaging should look like, and continue to kind of go back to the drawing board and fine tune that. And then also using those analytics to figure out who was visiting our pages to tailor the messaging and what it looks like. So for instance, like I said earlier, if a younger population visited our pages a lot, we would change our messaging to relate more to that demographic. So really utilizing those analytics in social media and advertising to tailor what your approach looks like. And then really collecting that data and analytics to tell a story of who are the people, who are interested in the content, and if the content is relevant to those demographics that are visiting your websites, and really using that to continue to pivot and, really fine tune what your messaging looks like. Next slide, please. Okay. And so with this, we really want to meet community where they are. And I'll go a little bit more in depth about what I mean by that. So during COVID, we made it our mission to be the healthcare organization that prioritized marginalized communities, because historically we knew that when pandemics and outbreaks happen within the community, it's usually the marginalized Black and Brown communities that are on more of the latter end of receiving a lot of the services that come out. And so we really wanted to make sure that we positioned ourselves as an organization that was going to make sure that we prioritized marginalized communities. And we built relationships with community organizers and influencers, as well as local legislators, to push our messaging through their channels, as well as work with them to combat hesitancy within their constituencies. And so we began outreach in the fetish and kink communities, because we understood that there was a higher risk in the LGBTQ fetish and kink communities. And so that looked very different for us. We started to create relationships with bars and bathhouses and kink fetish groups to really start to work with them on the mpox hesitancies, and also just give them information on different mitigation tactics on how they could prevent themselves from getting mpox, and how they can continue to be safe and also keep their businesses and their families safe as well. We work with a lot of bars to create mitigation tactics on how they could help to mitigate the mpox spread within their businesses. And we work with bathhouses to continue to provide education and information for them as well, because we understood that there was an elevated risk in those kinds of places. And so we wanted to make sure that we were cognizant of that, and that because we learned from COVID that if we weren't in those places, then it would take a while for other organizations and other entities to get to those places. So while everyone else was going out into, some of the other communities that were less hesitant, we were doing the work in those hesitant communities that did not want the vaccinations, because we really wanted to make sure that we were providing that education from an early standpoint, because what we understood is that our presence alone was really starting to change the trajectory of how people looked at the outbreak. And so with that, we also increased our digital messaging and expanded to like our dating apps, and really started to, create messaging that was tailored particularly to mpox, and making sure that, they had all the education sources that they needed to make an informed decision about receiving the vaccination. Next slide, please. And then again, we talk a little bit about creating that tailor approach. Communities are extremely unique, and how we approach them should be unique as well. And your consistent presence in the community is extremely important. One of the examples of this is, I remember a time in COVID-19 when we were talking with the COVID team, and everybody was talking about, sorry, I lost my train of thought. Everybody was talking about COVID-19 and how we weren't in the certain communities that we needed to be to combat it. And so what we did was we set up these satellite stations within marginalized communities, where we just had a presence. Even if nobody came to get tested or get vaccinations, it was just because we were in that space. It started to really change people's perspective on what was happening with the pandemic. And then we also wanted to be respectful of cultural and social norms of the community. Most of the times when nonprofit organizations or community-based organizations come into a particular community, they have a particular vision about what the community is and how they want to complete the work that they want to do. And being respectful of cultural and social norms is extremely imperative to building a positive rapport within the community. So really ensuring that you're taking heed to what's already happening in the community and uplifting that work, rather than trying to come in and start something new working with those people on the ground who are already doing that work and uplifting the work with them is going to be extremely important in building rapport, not only with the community itself, but with those community organizations who you see to be your partners in this work. Next slide, please. And so with that being said, these are a few resources that we have used. I wanted to make sure that since social media was a huge way on how we get our health messaging out, I put all of the links to our social media websites right here in the slide. So you'll be able to click on that and just see some of the messaging that we've done. We've done a lot of different Facebook Live videos during the COVID-19 pandemic to get information out to particular demographics and populations. So we did a complete COVID-19 town hall completely in Spanish for the Latino, Latinx, and Latina populations. We also had one that was tailored to Black communities. We also had one that was tailored particularly to the LGBTQ community. So we really tailored our messaging to really be where it needed to be for who it needed to be for. And we were very cognizant of that. And so just taking a look at some of the resources that we've used. We've also used TikTok now. We've started a TikTok because we realized that, you know, youth are really big on TikTok. So we started a TikTok to get some of the health messaging out. Please take a look at those. And then we also started a podcast, Charting Queer Health, and that podcast really talks about a lot of different things that are going on within the queer community and how we can, you know, really start to address some of those things and just not even address them, but really just start to have conversations, because there's not enough spaces where queer folks have conversations about what's going on with them. So we really wanted to create a space where we could talk about queer health specifically and address some of the concerns that we have within this particular community. And with that being said, I think that that is the last of my slides. Thank you so much for your time today. And if there are any questions that you all have or suggestions or concerns, please feel free to shoot them in the chat.
Thank you so much, Rashad. As I mentioned before, there's just so much information that Rashad went over, and it's all so useful that we really do hope that you refer back to these slides because it's all really great. And everyone's been putting it into the chat box, like, when can we get the slides? And this is all great work, and I definitely agree. One question that we have that came through the Q&A panel is the targeted population the reason why there are only a few Howard Brown facilities located on the south side of Chicago when there are several located on the north side? Is one of the first questions. Oh, Rashad, and you're muted right now.
Oh, no, that's a great question. Thank you for asking. And I would love to talk a little bit more about that. So Howard Brown has been around for probably about 40 years. We started in 1974 in a basement on the north side with a group of volunteer doctors who were trying to combat HIV in the gay community. And so our roots are on the north side, and we have 8 locations on the north side. And most recently, our most recent location on the south side was the 63rd location. And that was as recent as 2015 when we first came on the south side. So my team is actively working to build relationships within the south side. And we're also building other clinics on the south side as well. And I think that's just because we kind of wanted to make sure that we had a great presence and rapport on the north side. So we really focused on that first. And then after that, we really started expanding to the south side. So now we have 3 locations on the south side. And we're looking to build a 4th location. And we're also outgrowing some of the locations that we have. So we're actually looking to build additional locations to have standalone buildings and buildings where we're sharing space with other organizations or partners. And so we're actively talking about how we can continue to expand our mission on the south side. And we've been very cognizant about that and making sure that we're having the right conversations with the right people to really suss out what that expansion looks like. But that is a great question, and thank you for asking. We do understand that a lot of our needs are on the south side with marginalized communities because we have done such a great job at supporting the north side with a lot of the resources that we have. And now it's just time to transition those resources from the north side to the south side.
Perfect. And so the second question that we have here is, I'm not sure if I missed this, but was there any particular methods you use to combat misinformation regarding MPOX only impacting the LGBTQ plus community. And so I think it is a little bit of, I think you did cover this to some extent. Again, the question did come from someone who mentioned that they may have missed it. I think they're looking for particular methods. Maybe if you can go back to a little bit what you covered, the methods that you use specifically on combating that misinformation.
Mm-hmm. Yes, so with MPOX, we did several different things. So we had a social media approach where we really used social media to have town halls and webinars to create a space where folks could get information and ask questions about MPOX. We also created relationships with the fetish communities and bathhouses, as well as gay bars and LGBTQ bars without the city, to meet folks in untraditional spaces, to be able to do outreach for vaccinations in those spaces where they were. So that was two ways that we've done it in regards to outreach and social media. And then the third thing that we did as well was provide technical assistance to our businesses in the LGBTQ community to use them as avenues to get the information out to the community if it wasn't through social media or through a specific bar or bathhouse or group that we've partnered with. We wanted to make sure that those businesses also had that information as well. So we took a multifaceted approach to getting the word out about MPOX. I hope that answers your question.
I believe so. Yes, it looks like folks are saying excellent information, great methods, and thank you for sharing. I think it's just amazing to see how well, Dr. Rivera's information complements the examples that you shared, Rashad, and I hope that everyone is able to really come back to these slides, as I mentioned. I will make them available for everyone in a follow-up email so that you do have the slides to go back to so that you can click around on the links. There's so many links included in these presentations. And if you ever have any questions, I think it's amazing that the speakers have been making their email available so you can reach out to them and say, hey, what was that one thing that you mentioned that really worked really well for you? And then of course, you can always reach out to me here at NCTSTA or one of our other members of our team, and we'll be more than happy to connect you with those resources. And then one of the things that feel free to share if anyone wants to share resources that they're well aware of in the chat box. This is definitely a space to be able to share that now. And one thing I want to welcome or invite everyone to do at this time is to please, very, very pretty please, please share your feedback with us. The evaluation is linked in our chat box at this time. You're also more than welcome to open up the camera app on your phone, hover it over on this QR code here, and it will link you to the evaluation. If you're sort of running away from your computer at this time, you can do it on your phone. The information that you provide us, which will include, of course, how you felt about today's speakers and the presentations overall, but we'll actually be looking to see what other topics are you interested in. So if you can please go ahead and take a minute to do that right now before you click out of the webinar session, that would be amazing. We promise it won't take much of your time. And we really do appreciate and value this information that you share with us. We review it and we do come back to it to see which topics or what ideas you're coming up with to hopefully plan future webinars. It's something that we want to know, of course, a little bit of what our speakers covered today. It's great if we can come up with ideas on webinars and share information with you all, but we want to know what's going on in your communities. What are the communities looking to learn more about? What are you seeing in your communities so that we can actually create webinars that are useful to you all, as you're the ones that are bringing this information out to your communities. So that's what our goal is here. And we really do hope that you can take a minute, complete the evaluation, and we'll come back to your responses. And so with that being said, I'll leave this up for a few more seconds so that everyone can open up this link on their phone or in their browser. And we do have a few more minutes before we close out the session, so I can always come back to this slide. But again, I want to thank our speakers for today. You just did such an amazing job with everything that you needed to cover, and just sort of driving all these points home so that everyone can come back to these and apply these principles and the suggestions that you have shared to their current and future work. So again, I want to thank you both for doing such an amazing job with these presentations. And again, our audience members for today, our participants, thank you so much for taking the time to listen to our speakers and to be here with us. I'm going to ask our producer Shay to drop our listserv link in the chat box so that you can sign up for our monthly subscriptions or our monthly emails or newsletters, as well as updates for our next trainings and webinars. But if you have any questions whatsoever, whether it has to do with services that we offer here at the National Training Center, or questions about today's presentation, please feel free to email me. I'd be more than happy to connect with you all. And then again, before we wrap up here, I'm going to go back to the evaluation slide just so that you can take a second to complete that. And then if anybody has any questions, feel free to ask in the Q&A panel. We do have another 2 minutes or so to pick our speakers' brains here. So feel free to ask other questions if they're coming to mind. Perfect. And yes, my email, I'll actually type it into the chat box as well so I can connect with you all. Thank you for asking. And that's rgarcia@proceedinc.com. And Corin, I apologize if I'm mispronouncing your name. No, unfortunately, we are not able to provide CHESS credits. But if you happen to, I can say this to anyone, if you happen to need some type of certificate of participation, please feel free to email me. Perfect, and it looks like we don't have any additional questions that have come up in our Q&A box here. But again, I want to thank our speakers, Dr. Rivera and Rashad Bell, who have, again, just expressed everything that you can possibly need, at least on a fundamental level, to be able to get started on understanding how to combat misinformation, how to utilize social media to reach those populations that you're looking to engage with over social media. As we all know, this is such a hot topic now in public health, especially. So we're looking forward to seeing how you utilize this information. And again, if you have any questions at all, you're more than welcome to email me directly, and I can connect you with our speakers for today or any resources that they share. And I promise we have plenty of resources to share with you through the speakers' presentations that will be emailed to everyone in a follow-up email. And the recording will be made available as well. So with that being said, it's 3:30 p.m. Eastern time. So thank you everyone for joining us today. And we hope that you enjoy today's session. Thank you so much.
Thank you.
Take care.
Thank you. Have a great day.
Likewise.
Bye.